Well, good evening and welcome. I'm Lisa Goodwin with St. Charles Health System, and it is my great pleasure to welcome you to our Crook County COVID-19 Community Update. It's a joint presentation by Crook County Health Department, Crook County Fire and Rescue, St. Charles Health System, and Mosaic Medical. We are broadcasting live this evening on Crook County Health Department's Facebook page, as well as St. Charles Facebook page and YouTube channels. We welcome you throughout this evening's presentation to post your questions on those pages where our staff will see them and post them to a notebook where we will be able to go over them and ask them to our expert panelists toward the end of the presentation. So we'll have about 45 minutes of comment and about 15 minutes of Q&A, and we will do our very best to get through those Q&As. So it is my great pleasure to introduce you to Katie Plum, who is the director of the Crook County Health Department and is going to start our presentation this evening. So Katie.
Good evening, everyone. Hello, thank you for joining us. We have lots of presenters here joining us tonight and panelists, and I want to express my appreciation for our partners who are here, as well as our community members who are joining us online. We're joining together this evening to increase local communication regarding how the pandemic is affecting us and what's being done in response. So one of the roles that local public health has is to convene stakeholders around issues that affect health in our community. And with an issue as large as the pandemic, our little health department has had to grow in ways that we didn't think were possible. So I want to acknowledge the staff members at the health department who have really gone above and beyond over the last several months to serve our community during this time. And in addition to our staff, we've had volunteers and our partners who have stepped up in incredible ways to support our community throughout the pandemic. And I try to take every chance that I get to acknowledge the generosity of our community and the dedication that's been demonstrated in response and in support of each other. As Lisa said, we have several of our partners here today that will be presenting and then available to answer questions. So again, I just welcome all of you and express my gratitude for you all being here and taking time to join us tonight. I believe I am steering the boat here, so I will move our slides along and I get to start us off with a little bit of data. This is a slide that represents the duration of the pandemic in Crook County, and these are new case numbers by week. And on the far end of the slide, you'll see for the week of September 26th to October 2nd, we had 152 new cases. And that is the highest number of new cases that we have had during the entire time that COVID has been in Crook County. So while there's talk that the surge is on a downtrend at the state level, we are not seeing that downtrend yet here in Crook County. I'm going to pass off the next couple of slides to Dr. Natalie Good. She is the health officer for the health department and also a physician with St. Charles. Natalie, I will turn this slide over to you.
Hi, great, thank you. Okay, I think I'm on here. So this slide shows us the Crook County positivity rate and test volume to date. And so here you can see the three big surges that we've had of COVID cases. And you can see in our most recent surge, where we've just seen we have more cases than ever before, we are not doing more testing than ever before, actually doing a little bit less testing than our last surge. And despite that, still having more cases. So increased cases are not because of increased testing. It's because of increased volume of cases. So our test positivity rate is currently near 15%. So of all the people coming in for a test, we're seeing near 15% of those come back positive. Next slide. Oh, sorry, I'm back. So this slide shows, you can hear me now? Okay, thank you. The vaccination rate in the Tri-County area between Deschutes, Jefferson, and Crook County, broken down by age group. So you can see which populations are most vaccinated where, and in every age group, Crook County, the little gray bar, we have a less vaccination rate or a lower vaccination rate than the other two counties. Though our vaccination rate has improved, we've had a lot more people in the last month seeking the vaccine, which is great. This shows in Crook County residents that are vaccinated by age. So this is just showing our Crook County data. I think the important note here is where the majority of our new COVID cases are coming from, and it's truly those less vaccinated categories. So last week alone, the majority of our COVID cases, the highest group, that 18% of COVID cases came from our 30 to 39-year-olds, 17% from our 10 to 19-year-olds, and 13% from our 50 to 59-year-olds. And so you can see that fits with groups that are less vaccinated.
Thank you, Natalie. This slide is one that has made its way into several public meetings over the last month because it is very stark. When public health looks at data, all of them are estimations. They're not exact. And so I'll give a little bit of background about where this data comes from. We pull vaccination rates from the alert database, and information that goes into alert is from locations that are administering the vaccine. They enter that data, and then we're able to pull that information out of that database. Residents' information is self-reported. And so again, therefore, these numbers are estimates. It is possible that people who live outside of the city limits have a Prineville address, which again means this slide is an estimate. What we use this information for on the side of the health department is internally to plan access points for vaccine, maybe outside of the city. So we might have a mobile clinic that goes out into outlying areas to make sure that if we're seeing lower vaccination rates in other areas, it's not because of a lack of access. The health department needs to make sure one of our roles is that access is not a barrier. And we don't want to just be centering our efforts in town if a large percentage of town is already vaccinated. So we are working with some partners to do more precise mapping. But in the meantime, what this shows us is there is a stark contrast between, it might not just be the city of Prineville or within the city limits, but the city of Prineville and surrounding areas, does have a higher vaccination rate than our outlying communities in the rest of the county. And it is a pretty significant difference. And so we recognize that and want to make sure, again, that access to the vaccine is not the barrier to that difference, to people getting the vaccine that might want it. All right. I believe this is my last slide, and this is representing Crook County residents who are fully vaccinated and who have been hospitalized. That is in the blue. I'm sorry, those who are not fully vaccinated and who have been hospitalized are represented by the blue bar, and those who are fully vaccinated and who have been hospitalized with COVID are represented in orange in this chart. So we'll note that overall, so these are referred to as breakthrough cases a lot of times. Overall breakthrough rates that are hospitalized are fairly low. We have seen an increase over the past month with 23% of our hospitalized patients who were vaccinated and were hospitalized. I'm going to pass this next slide on to Dr. Maggie King.
All right, thank you. I don't know if you can see me. I can't see me on the screen right. Okay, so September, unfortunately, was the worst month of the pandemic in almost every respect. So unfortunately, this is not over for us. And this slide, these are real data. This is our data. It's not coming from anywhere else. This is our system's information. And it's meant to inform you. I don't mean to scare you, but this is our reality on a day-to-day basis at St. Charles. And so we want to be as transparent as we can about what's going on. And my upcoming slides are going to be more informative, but just so you all are kind of aware of what we are living right now, September had the highest number of deaths, the most cases, the most hospitalizations, and this is for the system. So this is the Tri-County area. We're going to break down into Crook County numbers soon, but the most ED visits, both adults and pediatrics, and most pediatric hospitalizations. It also had the highest breakthrough rate, as Katie just showed, and that breakthrough rate is thought to be because of the Delta strain. It's just more contagious. People carry a higher amount of the virus, and those folks who have been vaccinated, some of that immunity is starting to wane, which is why we're seeing third doses being made available. Next slide. Okay, so this is our Crook County positive cases. I think this is very informative. Unlike the state data, Crook County numbers are still rising. So in the last 7 days, we've had 680 per 100,000 cases that are new, the highest double that we've had in the past months of the pandemic. So we are certainly not slowing down. Unfortunately, we seem to be speeding up. Next slide. So this graph looks very similar to the last graph that we saw. These are how many hospitalized patients there are, and this is in the entire system. Those numbers are just going up. September had the highest number with 384 total hospitalizations. And this, to make clear, we're not really doing a whole lot of other things in the hospital right now. We've really been taken over by COVID. Those of you who've had your elective procedures canceled, your orthopedic cases, your gallbladders, those have been put on hold because we have so many patients that have COVID. So this is not because patients are, oh, by the way, getting diagnosed while they're in the hospital. Most of these far and away cases are because people are actively infected. Also, we've gotten better at figuring out ways to keep people home. It's a struggle, as if any of you have had a loved one hospitalized, you can't visit with a COVID diagnosis. So we're trying to keep the less sick people home as much as possible. We're getting them home with oxygen. So really this graph shows the sickest of the sick that are currently or have been hospitalized. Next slide. So this is Crook County patient days. So this is far and away our busiest month for Crook County alone. This is when I'm really grateful to be part of a larger system. This number of patients would have overwhelmed our hospital here in Prineville. And so all of these patients who are COVID positive are cared for at the Bend Hospital. And Crook County's numbers, unfortunately, we have about 5% of the Tri-County population, and we had 11% of patient days. Next. So this is our pediatric emergency department visits. The blue line is the number of pediatric COVID hospitalizations. The orange line is how many of those were in the emergency room, and this is with a COVID diagnosis. So this is a true representation of people visiting with that COVID diagnosis. Next. As we talked about, you saw on the first slide, this is mortalities that have happened in the last month. This was unfortunately our largest month, far and away above double what we had been having before. There has been questions about whether people are truly dying of COVID. We hear a lot about underlying conditions. Really what counts as an underlying condition is diabetes, high blood pressure, body mass index over 25, coronary artery disease, COPD, stroke, and cancer. So these are not unusual diagnoses. These are also not diagnoses that would cause death. And so really what people are dying of is COVID. Their underlying conditions make them at higher risk for death, but truly it is a COVID diagnosis that is causing these mortalities. Next. These are our Crook County numbers. So September unfortunately kept pace with August. We had 7 deaths. And again, these are hospitalized deaths, so probably more that were not hospitalized. Next. And then there's been a question of, are we really seeing a higher number of deaths with this virus being active? I don't have data prior to 2019 because we had a different computer system, and so that data is really tough to pull. But clearly there is a trend that we're seeing from blue line 2019 to kind of that greenish line in 2021. So definitely we are seeing a higher number of in-hospital deaths over that time frame. Next. And again, just to bring the point home, our primary cause of death diagnosis significantly is COVID-19, whereas 2 years ago, we'd never heard of this. It is now our leading cause of death year to date. Next. Okay, so I'm going to turn it over to Dr. Maree, who is our infectious disease specialist and knows so much more about the vaccines than any of us, and is a great wealth of information. So thank you, Dr. Maree.
Oh, thank you for having me. And I'm really happy to be here talking beautiful Crook County. Let me talk a little bit about the Delta variant and vaccines. I'm going to do an abbreviated presentation here, about 10 minutes, but we do have a talk that is available on our website for kind of a more extensive discussion of the variants and the vaccines, if you want to delve into a little further. So what happened here with this surge? Surge we did in the end of July and into August and now into September. And it really has to do with this Delta variant that we've had exposed into our community. It overtook all other variants in our community within about 4 weeks. So just really a rampant rise in this Delta variant. And here are some of the attributes of the Delta variant that I think lead to this surge. One of them is its increased transmissibility, and some of you may have heard of this term R0. And that really is just talking about if you have one person who's infected with Delta or with COVID, how many people are they likely to transmit that virus to at one time? And we can see with our original strain, we really thought that was around 2 to 3 people, where now we're getting to a transmission of about 6 to 9 people from one person. And so that transmissibility is a huge factor. The other factor, which probably ties into some of its transmissibility, is the increased viral loads that people get infected with. So when we sample samples from the nasal passages, we can see that people have about 10-fold higher amount of the virus than with our other strains, our alpha and our original strains, when they get infected. So what do we see with that higher viral load? We see that people stay infectious longer. So instead of 14 days, we really see that your infectious period could last even possibly longer, theoretically out to 18 days because of those higher viral loads. We're also seeing a shorter incubation period, meaning people are getting sicker faster within 4 days instead of 6 days. We also see an increased risk of reinfection with this, where the virus can actually overwhelm the natural immunity more frequently, and increased breakthrough infections. And we'll talk about that a little bit more, particularly of symptomatic breakthrough infections. And then there may be more severe infections. We see that our mortality is quite high right now. And then there may be some more severe infections that are happening in the pediatric population. We have seen more ER visits and a little bit of uptick in our hospitalizations, but thankfully that hasn't been a huge factor as of yet. So let's talk about vaccine effectiveness right now in the time of Delta. So the vaccines have still been very effective against Delta. We do see that they have decreased a little bit. And so at their max effectiveness, you can see here Pfizer, when you have a confirmed infection in alpha, it's about 92% effective against any all-cause infection, and about 79% with Delta, where for symptomatic, it's about 88% with Delta opposed to 93. And Moderna, you can see for symptomatic disease, it's around the high 80s in this study. And then for all, that includes Johnson & Johnson, for hospitalizations, you're really in the 90s for effectiveness, and that was not changing. Next slide. So this is a couple slides just talking about the two types of vaccines that we currently have available in the United States. And the first category is the messenger RNA vaccines, which teach our cells how to create a harmless piece of protein called spike protein, which is displayed on the host cells, and your immune system reacts to that, and that's what builds the antibodies, and then later the memory humoral immune system to combat future infections. They do not use live virus, so you cannot get COVID from the vaccine, and they do not interact with your DNA in any way. This is the other class of vaccines that we currently have available. It's the viral vector vaccine, or the Johnson & Johnson, or Janssen. And that's basically what that vaccine does, is it uses a viral vector, so adenovirus, which is deactivated, and it uses that vector in order to transport the mRNA and allow for your cells to then create that spike protein and basically go through the same process. The advantage to this mechanism is that you had increased stability. So these don't need ultra cold storage. They don't need a lot of special handling, and they last longer before they're given, so we can store them for longer. And this is a schematic that just kind of shows that viral vector vaccine, but really kind of what does happen with most vaccines, where you get an injection of the vaccine that will go to the host cell, helps the host cell present that spike protein. The antibodies react to that, create antibodies against the spike protein. That then is broken down by your body and eliminated. And the antibodies help with creating a lasting memory immunity to the virus. Next slide. I created this table just to help us kind of compare the three vaccines. I didn't really find a good place to look at that comparison. So you can see we have the 2 mRNA vaccines up there top, and then the Johnson & Johnson. Our Pfizer vaccine is the 2-dose series at 21 days, unless you're immunocompromised and you have a 3-dose series. It's currently FDA approved. The side effects are there in the trials, and those held pretty true in real world, where you have about, most of the symptoms are really this kind of this viral symptom of fatigue and headaches and muscle aches and chills. And you can just feel like the beginning of almost like a little bit of a flu that usually lasts for about 24 to 48 hours. The adverse events that you see with the mRNA vaccines that we have detected, the number one is the myocarditis and pericarditis, and that tends to happen in younger men. It's about 12 cases per million. And that's usually treated with ibuprofen or self-resolves and is rarely a serious complication. Also, you can see anaphylaxis in about 1 in 1 million. Moderna is very similar side effect profile. It is not currently FDA approved, but it's they have applied, and I'm sure they will be getting that full FDA approval soon. The one thing that's different is they do have a little bit increased side effects when you get this series of Moderna. That probably has to do with the fact that it's about double to 3 times the same concentration as Pfizer when you get that dose. That may have advantages later on with having a longer lasting immunity, which may be what we're seeing in the studies when we're looking at vaccine effectiveness over time. And then Johnson & Johnson is the 1-dose series. However, you may have read that the latest studies show that it may actually be better as a 2-dose series. So we'll wait and see what the future recommendations are on that. And that is the viral vector vaccine. It does have fewer side effects after getting the vaccine. You have less of that immune response. It has 2 adverse events that they are currently tracking. One is the thrombosis with thrombocytopenia. So that's clotting with low platelets. And it occurs in about 20 cases per million, and it occurs mostly in reproductive age women. In addition, there's Guillain-Barré syndrome, which is a peripheral neuropathy, again, usually self-limited, and it occurs in 8 per million. So the advantage of that vaccine is really that 1 dose. However, there may be some lower efficacy with the 1 dose and minimal symptoms for people. Next slide. So this is the latest study that really was pivotal, I think, in the advisory council making their recommendation for booster doses for Pfizer. When you see here, they're looking at vaccine effectiveness for people without immunocompromising conditions, so healthy immune systems. People who got vaccinated with the different vaccines, they tracked them over time for effectiveness. And you can see here with the Moderna, when they looked at greater than 120 days, they really see that the vaccine effectiveness seemed to hold true to 14 to 120 days. But when you look at Pfizer, you see that it decreased after 121 days, really from the 90s down to 77. Johnson & Johnson, they had not tracked it out long enough, but greater than 28 days, it still seemed to be holding about the same. So that's really, I think, the pivotal information that the advisory council used to make that recommendation for the booster once you got to be over 6 months in order to increase that vaccine effectiveness. Next slide.
I think, Dr. Maree, those are all of your slides, and I'm going to transition us into, thank you very much. I am going to transition us into talking a little bit about monoclonal, oops, I think I jumped slides. There we go. I'm going to talk a little bit about monoclonal antibody therapy. I mentioned, one of the purposes of this event is to increase communications about what we're doing locally in response to the pandemic. And vaccinations is certainly our greatest and most powerful tool, but it's not our only tool. And so I want to share a little bit about monoclonal antibody therapy, or Mab. And what Mab is it mimics our immune system's ability to fight things like a virus. Typically, when we get sick, the body takes time to build up and produce natural antibodies. And so this gives someone who's sick a head start a little, it gives them a jump start to be able to fight the virus earlier, which might prevent them from ultimately getting sicker. And certainly a goal, if we can get them this treatment and prevent the need for hospitalization, that's huge. Treatment can be administered using an IV, or it can be given injection subcutaneously. And right now, there's some qualifications for therapy, and we have those listed at the bottom of this slide, but really it's for folks who are at high risk for becoming severely ill, if they weren't fully vaccinated or they're immunocompromised, certainly. And then there's risk factors at the bottom as well. But really, if you've seen your doctor, you've tested positive for COVID, having that conversation about monoclonal antibody therapy and knowing that that's available to you here could be and is a valuable option that I'm excited to be able to share that we have available here in Crook County. So when we're talking about resources, this slide lists locations that are offering vaccinations. And Crook County Health Department, there's a little bit of variation of what vaccines are offered at each location. So the health department is offering Pfizer, Moderna, and Johnson & Johnson. Mosaic Medical is offering Pfizer and Moderna. And I'm sure we can walk across the hall and connect folks with Johnson & Johnson if that's what their vaccine of choice is. St. Charles is offering all three. Is that correct? Can I get a confirmation of that from someone?
I think at our medical group, it's currently still just the mRNA vaccines.
So Pfizer and Moderna? Mm-hmm. Okay, perfect, thank you. And then Rite Aid is also offering Pfizer and Moderna. And Bimart here in Prineville is offering the Moderna vaccine. I'm going to pull in Mr. Matt Smith here to share a little bit about how we're administering monoclonal antibody therapy here in town.
Well, thank you, Katie. My name is Matt Smith. I'm the fire chief here in Crook County. And just we're a community partner. We do have, a role in healthcare. And so in some conversations we had with the hospital and with Katie at the health department, we realized we could help get this important treatment out there. So we are currently administering the Mab Therapy, which is really 4 subcutaneous shots. We're doing it at the fire station. It's all run through the health department. So if people want to get that treatment, they can go through the health department. They will schedule it and then tell you where we're at here at the fire department to give it. We're excited to be a partner and support the health department.
Great, thank you, Matt. And we are taking referrals from, so if folks go into St. Charles or Mosaic and they're seeing their primary care providers, we are taking referrals from providers to be able to schedule those appointments and then connecting with Matt and his team to administer treatment. Our next slide shows resources for testing in town. And again, when we're talking about partners and people pulling together to make things happen and make things available in town, testing is another one of those examples, because we've had limited supply, limited capacity. We still do. But when we were in a pinch, our providers have really stepped up and made this available. So right now, Mosaic Medical, you can self-refer online and make an appointment Monday through Friday for testing. And St. Charles is also doing drive-through testing at St. Charles Prineville, Monday through Friday, 8 to 4. One thing that we really want to make folks aware of is that after the 18th, St. Charles Prineville is not going to be able to support the need for COVID testing by employers or employees. So that either weekly requirement or whatever timing that is that employers are going to have, it is not going to be sustainable for our health system. And so we're really encouraging employers to plan ahead for that and find alternate locations and processes for employee testing.
Katie, this is Diana with Mosaic. Can I jump in?
Hi, Diana.
Hi. I just wanted to just kind of echo that, in that Mosaic also does not have that capacity to be doing weekly testing if that's something that employers are requiring for their employees. We're really trying to focus on those symptomatic patients or those individuals that have had some kind of exposure as well.
Excellent. Diana, is there anything else on Mosaic's end that you want to share? Any resources or announcements that you want to make?
Again, I mean, you've already said it as far as the types of vaccines that we have available. And then when we're doing our testing, the only other thing I just want to let people know about, and this isn't Crook County, this is outside of Crook County, but we have started a pilot at our Redmond and Madras clinics for Mab Therapy as well, and hope to continue that moving forward. And once we have the staffing capacity, try to support that in Prineville as well.
Excellent. Thank you. Thank you for joining us. All right. That brings us to the end of our structured presentation time. So I want to, again, I started us out this way, but I really appreciate the time and energy of all of our presenters to come and share with us. And I'm going to pass it over to Lisa to facilitate our Q&A time. Hopefully questions have been coming in. If folks are watching and want to ask any questions about the presentations, about information that's been shared, or anything else that you've been thinking about that maybe we didn't cover, you can put those questions in now, and Lisa will facilitate passing them along to our panelists that are here and ready and excited to answer questions for you.
Great. Thanks, Katie. Well, thank you. Great presentation by all of our panelists, and we do have a few questions that have come in, so we will get right to it. First question, this is related to schools, and Katie, I'm going to probably punt this one to you. What are the metrics that you guys are using to gauge whether schools need to be closed? And on the flip side, when can masks be removed?
Yeah, that's a great question. We currently don't have metrics that there's no hard line that says the schools need to be closed when you reach this point in the community. At the local level, the health department here works basically daily. I'm looking at Wendy. We have one of our school nurses on the panel too, so I can, if she's got anything she wants to add, but we work daily with our schools to monitor the situation. And we're regularly looking at what is health and safety of our students, of our teachers is paramount. And so as is keeping our kids in school and progressing their education. So we are regularly having those conversations, and there are no metrics, at least from the state or the federal level, that have said you have to close when this or that happens. And I heard on the flip side of that, when when will we not be having masks? I believe it was along those lines, specifically in the school setting. Those conversations are typically happening at the state level, and we have not had any indication or clear statement of when those might be removed. They're a precautionary measure that's effective, and so certainly as long as our case counts are this high, we can expect to be using them to keep our kiddos and our school staff safe.
Great, thank you, Katie. And the second part to his question, in those metrics, we used to follow test positivity.
Mm-hmm.
Are we looking at a 14-day window of test counts, or what is the criteria we're looking at? And again, related to whether schools stay open, whether masks come off, et cetera. So what are those benchmarks that local public health departments and Oregon Health Authority are looking at to decide whether it's the right time to remove some of these safety precautions?
Yeah, so really all of the data that we looked at today are considerations, and we did look at test positivity pretty early on in the presentation. Again, there's no hard line in the sand because we have multiple levels of precautions that are in place, and the virus itself is very dynamic. So there are no lines drawn, at least at the state level, but the data that we looked at today are the measures that we're observing. And when we see drastic increases, we are working in lockstep with our schools and with any other partners that are affected by changes in the data to make sure that we're adjusting precautions accordingly.
Great. Well, a couple of questions, I think, for Dr. Cynthia Maree. First question, Dr. Maree, I'm pretty sure I got COVID a few months ago. Do I still need the vaccine?
Short answer is yes. We still recommend vaccination even after infection. The reason for that is that the evidence is really showing that vaccination with infection is much better protection than infection or vaccination alone. So that should actually protect you even better, may protect against having any kind of long-term effects if you do get reinfected again. So currently, that's the recommendation. I think, as we start to look at natural immunity and the interplay with vaccinations and the vaccines we have available, there could be changes to those recommendations down the road as we look at the science, but the science currently right now is still recommending you get fully vaccinated after your infection. You just need to wait until you're past that quarantine window. So usually about 10 to 14 days, and you need to be have most of your symptoms resolved or at least significantly improved before you go in for your vaccine.
Great. The next question, if monoclonal antibody therapy works so well, why isn't every patient eligible for it?
Do you want me to take that?
Sure, if you'd like to.
Yeah, I don't mind. Again, it's been approved under an emergency use authorization also, and it's really been looked at giving it in everybody. But the data really bears out for having its greatest advantage for those who are at highest risk for severe disease or death. And so when we look at giving it to the entire population, because a lot of people who do not have underlying risk factors may not get sick or severely sick. So in that case, it's not preventing that severe disease. The data, when we've looked at what we've been giving here at St. Charles, has been very impressive for benefiting those people with those underlying medical conditions, which is really exciting. I think we've given almost 900 doses out here at St. Charles, which is significant. So we have a number of patient population within our own community to kind of look at, what kind of effect are we having. But currently, when they've studied these two different combination therapies we're using, it really is targeted specifically at that population. And the important thing when you're giving the monoclonal antibody is that you give it early, because what it really does is it stops the virus from being able to enter the host cell. And so that stops the replication from happening. If the replication has already begun and is pretty out of control, this will not have much of an effect. So the important thing is that it's given probably within 7 days of symptom onset, but the EUA is 10, but we've really seen significant advantages to giving it within 7 days of symptom onset. So that would be the key.
Great, thank you so much. Dr. Good, I'm going to have you take this one if you would like. Why don't you treat patients with ivermectin?
Hi, that is a great question with a simple answer. It has not been FDA approved for us to use it in that way. There are some studies looking at ivermectin use, but we are only using medications that are approved and been shown to be safe and effective for our patients.
Great, thank you. This next question I'm actually going to pose to two of our panelists, Dr. Jeff Absalon, who is our incident commander for the health system for our COVID-19 response, and Mike Johnson, who is our senior data scientist. Mike lives and breathes COVID-19 data and has interesting insights. So the question for both of you, and maybe Dr. Absalon, you start first, what is the best thing we can do to help end this pandemic today?
Thanks, Lisa, and thank you all for the question, and thanks for getting together this evening. You know, as mentioned earlier, this pandemic is here. It has not gone away. I would say that it's a series of things that you can do. One, if you're not vaccinated, please get vaccinated. The vaccines do work, and they really do prevent severe disease. So I cannot reiterate that enough. But I think it's also important to use caution, as we have throughout the entirety of this pandemic, to keep your physical distance from people, to wear a mask, to wash your hands. Those things are really, really important. And so this virus is still spreading, as you can see. There still are large portions of our populations that are not protected with vaccinations, including young children. And so I think those are the combination of things that everybody can do to help curb the spread of this virus and hopefully get us to a state that's much healthier, where we don't have an average of 99 patients with COVID in our hospitals. So I'll turn it over to Dr. Johnson if you have something to add, and I'm sure you do, because you've got lots of data.
Thanks, Dr. Absalon. I think you nailed it, but one thing that I just want to point out is everything that Dr. Absalon mentioned are things that are within our control. It's like it's our behavior will produce the outcomes. So it's our choice to get vaccinated. It's our choice to, wear a mask and be physically distanced and wash our hands. These are things that are just very basic and we can control. And that's kind of the frustrating thing from my perspective when I see the numbers and the cases growing, saying, we have the ability to stop this. And there have been communities that have done that, some better than others. But that's my only thing to add.
Great. Well, thank you both. We only have one question left, and perhaps Dr. Maree wants to take this one. When do you expect the vaccines to receive an emergency use authorization for the 5 to 11-year-old population? And do you recommend getting your kids vaccinated?
Oh, yeah, I'd be happy to. Thank you, Lisa. So that is exciting news. 5 to 11, they currently have on the books to review that on the 26th of this month. So super exciting. That's the beginning of their review. It'll probably take a couple of days, it might take a week. But if we got authorization by Halloween, I just think that would be amazing, much sooner than I was actually anticipating. So I'm very excited about that. Yes, I definitely encourage you to vaccinate your children. I think they are an important part of our community. Not only are we seeing the cases going up there and the potential harm that can happen to children increasing, but also they are just part of our entire humanity that we have here in our community. And it's important that we're able to stop the spread of the virus in all of us. And so they are an important part of this process and effort to stop this pandemic. I did vaccinate my 2 children, and they did really well, and they're very excited to now have that protection. So I do recommend that when it's available. So I'm excited to see it.
Great. Well, thank you to everyone for joining us this evening, and thank you for the thoughtful questions. I think this has been a great dialogue. Please reach out to your public health department or our health system if you continue to have questions. We're always happy to help answer them. And Katie, I'm going to turn this back over to you for any final closing comments before we sign off.
Thank you, Lisa. Again, thank you all for joining us. I mentioned this in opening, but we really do intend to continue creating communication channels, whether they're online, whether they're in person, whether they're over the phone. Certainly we're taking into consideration community safety when we're planning events, but we want to be able to increase lines of communication with the community, with our partners, and so please keep questions coming in. You don't have to just ask questions when we're doing events like these, but we have our social media channels open. Phone and email is also always welcome. And if you have suggestions for additional ways that we can increase communication and have questions answered, we are certainly excited to hear about those and want to be able to provide that. That being said, a final thank you again to our partners for presenting and for helping put on the event, for my staff and all of the hard work that you put in every day. Thank you. And to our community, I wish you good health and a wonderful evening. And we look forward to hearing from you soon.
Great, thank you.